When you go to your state test, when you get there, you will draw a scenario card. There's some little cards that have 5 skills on them. It'll have the patient's name and age, their diagnosis, and then it'll have the 5 skills that you need to perform. So the first thing I'll have you do is a set of vital signs, TPR and blood pressure. You'll do a temperature, pulse, respiration, and blood pressure. Then you're going to either say or do the beginning procedures. Then you will do your 5 skills. Then you will either say or do the ending procedures. So I want to show you how to do the beginning procedures. First thing you're going to do, and remember WAGI a pair, you're going to wash your hands before you enter the room, and then you're going to assemble your equipment. So the scenario card that I drew for Mrs. DeBurke is I'm going to put her on the bedpan, help her use the bedpan, then I'm going to give her a partial bath, I'm going to change her draw sheet, I'm going to help her brush her teeth, and then I'm going to apply a wrist restraint. Then I will go to the patient's room and I'm going to knock on the door. I'm going to pause and wait for Mrs. DeBurke to respond to me. If she doesn't, I'll go ahead and go on in the room. I'm going to go to the bed. I'm going to introduce myself to Mrs. DeBurke. Hi, Mrs. DeBurke. I'm Claudia. I'm your CNA for the day.
Hi, Claudia.
I'm going to look at her wristband. Mrs. DeBurke, could you tell me your birthday, please?
10/22/74.
Oh, you're young. Good. Okay. And then I'm going to ask the visitors to leave, and then I'll tell them where they can wait. Then I want to provide privacy. And to provide privacy, I'm going to pull the curtain around Mrs. DeBurke, and I will also close the door to the room. I want to always explain what I'm going to do. So first thing is I'll explain the bedpan. Mrs. DeBurke, I'm going to help you use the bedpan this morning. Then, if there are any questions that Mrs. DeBurke has, do you have any questions about the bedpan? I know you've used it before.
I have.
Okay, good. I would answer those questions. I want Mrs. DeBurke to assist as much as possible, especially when we're doing transfers or brushing teeth, those kind of things. Let them do as much as they can for themselves and make them feel better about themselves. And then we always raise the bed. If I'm doing something while Mrs. DeBurke is in the bed, I will raise the bed up to a comfortable height so that I don't have to bend over and hurt my back. So those are the beginning procedures. WAGI a pair. How was that?